are you doing? I'm Dr. Joel Baumgartner. I want to talk a little bit about my book today, so we're pretty excited about this. It's basically a book on regenerative medicine or regenerative injections. I've been working on this for probably about going on 10 years now, kind of putting it together, and finally came together a few years ago. This is the fourth edition, the fourth rendition, so it's very up to date. And basically it's an injection technique book. It's really about the art of injection, because what we're finding with regenerative type injections, if you don't do the injections right, your outcomes are going to only be so good. So this really is an in-depth injection technique book to teach you how the safe way to inject. You know, I've been a student my entire life, and I'm still a student. I'm learning new things all the time, which is very exciting for me. I love to learn. And so the way I kind of created this book is from a student's perspective, in a very easy, logical way to understand. For me, when I was learning how to do these types of procedures, I was really wanting to know, where should I not inject? What are the, quote, high-risk, no-go type zones? Because if you can stay away from the stuff you shouldn't hit, it makes it a lot easier to hit the things you should be hitting. So this book very easily details those places where you shouldn't hit. It also talks a lot about examination skills. We need to know how to examine a joint to make the diagnosis. Once you've made the right diagnosis, of course, then you can go in and very thoroughly treat it with a regenerative type procedure. So it talks, basically about the examination. It goes over the skin marking. We need to be able to know where to mark the skin so that we can make the injection through those areas, and know where to mark the skin to avoid the nerves and the arteries and things we don't want to hit. And then it goes into a lot about technique. The angle, how deep to go, what to feel for. It is very complex. It has a lot of depth to it, but I think when we're trying to get a knee joint to regenerate or a spine to regenerate, those injections have to be very precise. We've got to follow a very logical way of approaching those areas, so it's very easily spelled out for you. So I'm very excited about it, because my goal is really to spread knowledge and to increase the quality of care that we're giving to our patients, because the better the quality of care, the better the outcome. We're going to try to create just a very healthy population through these types of procedures. So I hope you enjoy the book, and good luck and cheers to you all.